Hello. Before you go home, we're going to talk about your condition. Your lab result came back, and we realized you have a potassium level of less of about 2.2 milliequivalent per liter. This means your potassium level is low. And when potassium level is low, we call it hypokalemia, meaning low potassium. So most of these signs and symptoms you've been seeing, they are consistent with low potassium. Potassium is responsible for a lot of function in the body. It is useful for the heart contractility, that is the pumping of the heart, and the muscle contractility too. And so some of the symptoms that you saw, like when you had weakness in your muscles, and when you realized that your heart was beating irregularly, and then when you had pains in your muscles too, and when you had constipation, that was because your digestive system, the motility or the movement of your digestive system has reduced because of low potassium. And so those are the signs and symptoms you see. Most times when you have low potassium, it's usually because you have kidney problems. It's also maybe you have problem with the digestive system, like you're vomiting regularly, or you are having diarrhea, regular one, or maybe you have what we call diuresis, when you pass out too much of urine. And so these are things that, or in some cases, when the acid and base balance in your body is distorted, and so these are things that would cause your potassium level to drop. Now, you can get potassium by consuming food that are rich in potassium, such as oranges, avocado. Can also get it from you can also get it from bananas. Although hypokalemia most likely is not from poor dietary consumption of potassium, but it's also good you consume good potassium in your body because it's important for major function in your body. Now, to help you out with this, we have prescribed a drug for you, and this medication is called potassium chloride. So, potassium chloride comes in different forms: the tablet, the powder form, or the injectable. It depends on how severe your level of potassium is. So, if you are given the powder form, you have to dissolve it in water or oranges. It's better you dissolve it in orange juice because it is possible that it most likely has a very awkward and nasty taste. And then the tablets are quite big, so it's also important you note that. And then there are some side effects that comes with consumption of potassium, the oral form, which include you having it irritates your digestive system. So in some cases you could get bleeding in your stomach, and so that is an extreme case. It doesn't happen to everybody. And if you are to be given the injectable, we would have to dissolve it and push it slowly so that you don't get what we call ventricular tachycardia, ventricular fibrillation, which happens when you give it without dissolving it. And it's also important that if you have had any kidney disease, you let us know, or if you have kidney disease presently, you let us know, because you can't give potassium chloride to a person that have kidney diseases. Now, some of the side effects you get from taking this medication, they include you might feel pain at the site where the medication is being given, or even sometimes an inflammation to your veins, what we call phlebitis. And so when you know this, just know that there are just some mild side effects. And then, as I mentioned earlier, it irritates the digestive system, your stomach, and so it's also important you know that. Now, while we are giving you injectable of potassium, we will need to monitor your urine output. We'll monitor your potassium level, because just as low potassium is not good, too high of potassium is not also good. And so we'll monitor that also to be sure that your potassium level is within reach. Now, I've explained a lot of information to you as regarding potassium. If you have any question, you go ahead and let me know, because I know most of the information that you've been giving here may be new to you, but I would be more than willing to help you out if you have more questions. Thank you.